This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson and Sarah Giosi with you this morning. Good morning, Sarah.
Good morning.
And joining us in studio today is Dr. Allison Cihla, Preston Memorial Hospital, Critical Care Medicine and Pulmonology. I was going to struggle with that. It does not roll off the tongue well. Good morning, Allison.
Good morning.
How are you doing this morning?
Good, thank you.
We're going to get into several different topics this morning. Accessibility to comprehensive pulmonary care over in Preston County will be our main focus. But before we get into all of that, let's meet you a little bit. Give us a little bit of background and where you're from, how you got here, what you do.
Sure. Well, I was born and raised in Elyria, Ohio. I went to medical school at the University of Toledo.
Okay, where is Elyria, Ohio?
Elyria is about 20 miles southwest of Cleveland.
Okay.
Yeah, so right up on Lake Erie.
Okay.
Yeah. Then I went to the University of Toledo for undergrad and medical school. After that, I came to WVU in Morgantown to do my residency and my fellowship in internal medicine and pulmonary and critical care medicine.
You know, one of the things that we've learned in doing this show, Sarah, is that a lot of the things you think of, well, I've got to go to Morgantown or I've got to go to Pittsburgh, is offered at Preston Memorial Hospital. And I think a lot of people may have that perception. Again, if I live in Kingwood or I'm somewhere out in Preston County, I've got to drive all the way in.
Right.
I've got to make that trip. And the fact of the matter is, Dr. Cihla, that you don't have to do that.
That's right. I started at Preston Memorial Hospital about almost 3 years ago. And before that, there was pulmonology there, much less frequently. And so you did see a lot more people coming to Morgantown or going out of the area for that care. And now it's nice that patients can stay in the area and still get the same care that they need.
And what kind of care is that? What kind of conditions are you treating?
Sure. So in the pulmonary clinic, we treat patients that have any type of respiratory disease, asthma, bronchitis, COPD, which is chronic obstructive pulmonary disease. We treat patients with occupational respiratory diseases. We can treat acute conditions like pneumonia or pulmonary embolism. And we also have sleep apnea that we can treat through our Reedsville Sleep Center. And then also pulmonary hypertension, really any type of pulmonary disease that you can think of.
A wide range there of everything kind of covered.
What kind of procedures, what kind of tests are you able to perform there at Preston Memorial Hospital?
Sure. So, we can't do everything. There are some things that we do refer out, but for the most part, we can do a lot of testing at Preston Memorial Hospital. I am available for pulmonary consultation, so if you were to be in the hospital and have a pulmonary problem, you can be seen. We also do pulmonary function testing, which helps us to diagnose different types of lung diseases. We can do chest imaging like x-rays and CT scans. We also do oxygen testing to see if you might be somebody who would need oxygen to breathe a little bit better. And more recently, we added some newer testing, including methylcholine challenge testing, and that is to further delineate somebody that we think might have asthma, to give them, a more concrete diagnosis. We also started just about a year ago our pulmonary rehabilitation program, which helps to condition patients with chronic lung disease to breathe better, breathe easier, and have less symptoms.
I find and you've mentioned it a couple times now, the sleep testing. I find that really, really fascinating. So if I'm someone that's having trouble sleeping, is that all I need as a prerequisite to come and speak to you? Or is this something where I know I've already got some of these other issues and I'm having trouble sleeping? Talk to me a little bit about how I would get signed up for something like that.
Sure. So the sleep testing is done at our sleep lab in Reedsville. And what they're looking for are things like obstructive sleep apnea or central sleep apnea, other things like narcolepsy, and some of the sleep diagnoses. Insomnia, they can see you for that, but it's more of the clinical sleep apnea type diagnoses that they deal with on a daily basis. Usually those referrals are made through your primary care doctor to the sleep lab directly.
Talking to Dr. Allison Cihla from Preston Memorial Hospital, critical care medicine and pulmonology. Pulmonologist, is that correct?
Pulmonology is the field, and I'm a pulmonologist.
Okay.
Yeah.
Well done, Dave.
All right. I'm learning after several weeks here on the show. We're going to continue the conversation, talk about pulmonary function tests when we come back on the other side of the break. Who should consider them, and, well, what are they? We'll talk about it coming up next. It's Mon Health Talk on WAJR. Joining us in studio this morning is Dr. Allison Cihla, Preston Memorial Hospital, critical care medicine and pulmonologist. That has to do with the lungs. Sarah, I knew that. See, I've watched Grey's Anatomy once or twice.
Oh, no.
Used to be a big ER fan, but that's another story. All right, pulmonary function test with what we're going to be talking about for most of this segment. First of all, Allison, when I'm talking about a pulmonary function test, what kind of tests are we considering here?
Pulmonary function tests are breathing tests that are performed to help diagnose different types of lung diseases. We look at different functions of the lung, how well the lung takes air in, how well the lung gets rid of air, if there's any air left behind. We also look at how well the lungs exchange oxygen for carbon dioxide. So really the basic function of the lung is what we're looking at.
So who should consider or who would be considered for these kinds of tests?
You would consider these tests in anybody that has any type of chronic respiratory symptom, like a chronic cough or wheezing or shortness of breath. Those are usually the people that are considered for testing. We can also check and see if your lung condition is mild, if it's severe, if it's changing. Sometimes we look to see how well our treatments that we're providing are working. So we look to see if the inhalers are working or other types of medication are slowing progression of disease or things like that. We can also look at patients that have occupational exposures to dusts or chemicals and see how those are affecting the lungs. And then another time that we use pulmonary function testing is before some types of surgeries, specifically surgeries that have to do with the heart or the lungs.
You know, especially being in the state of West Virginia, whenever you were talking a little bit about dusts or chemicals, of course, one of the things we think a lot about here is black lung because of how many coal miners we've had in the fields. And it may even be that we don't have as many as we used to, but the ones that we did have were in there for 30 years, 40 years.
Correct.
So does that play a big role in what you see day to day?
It does. You mentioned we've got these patients that have been in the mines for 30 years. We also have patients that haven't been in the mines for that long, but they're getting so much better at their job, and so they're turning up lots more dust. And so we're starting to see occupational lung diseases at an earlier age.
And I think I'm probably jumping ahead here, but I imagine smoking would play a big role in what you do day to day as well.
Correct. I think maybe even more than mining and black lung disease, I see patients every day that are smokers or former smokers. So
Well, I was going to say, since you jumped down to the next bullet point there, Sarah, how do you screen for, when we're talking about lung cancer, how do you screen for that?
So a couple of years ago, the major societies came out with recommendations to do something called a low-dose screening CT scan to look for lung cancer. They had studied this for years and found out that chest x-rays really didn't give us enough information, but doing these CAT scans or CT scans did give us some more information. And so these are CT scans that are of the entire lung, but at a much lower radiation dose. And the recommendation is to do these once a year for patients that fall between ages 55, and the upper limit is sometimes 77, sometimes 80 years old. And these are in patients that are either current smokers or patients that have quit smoking within the last 15 years. And these patients have to have had to smoke 1 pack of cigarettes a day for 30 years or 2 packs a day for 15 years or something like that in order to qualify for these CT scans.
And again, all of that's painless. It's not something that's going to put you out.
Correct.
Or be something that involves a lot of needles.
Correct.
And
No
things
needles.
like that.
No needles,
so
no pain.
When people are thinking about, because I think we hear tests or we hear screening or anything medical, and you
Right.
immediately get that twinge of fear.
Right.
And there is no need to have that. We need to be keeping an eye on things and making sure the earlier we can catch stuff, the better off a person will be.
Correct. So the idea and the hope behind these CT scans is that the earlier we can catch the cancer, the more treatable it is.
And, going back for just a second, you were saying, if you'd been smoking within the last 15 years, and I mean, I'm just going to, I guess, give you one quick opportunity here to say, hey guys, quit smoking. Right? I mean, that's one of the first things that we should be saying. If you want to avoid some of this in the future, please stop smoking.
Exactly. Every patient that I have that has seen me before knows that when they come in, if they're still smoking, they're going to hear it from me at least once.
Sure.
And it's not just important because we want to prevent lung cancer, but we also want to prevent head and neck cancer. We want to prevent heart disease. We want to prevent strokes. All of those things, are tied in with cigarette smoking.
Well, and we talked about that a lot last week because we were talking about heart health.
Right.
And how much smoking. We think about smoking a lot whenever it comes to the lungs, but we don't think about it with all of these other things.
Right.
And I'm a mother and soon to be a mother of two. Secondhand smoke is also really important and can, I know I'm totally off topic here, Dave. It's fine.
No,
secondhand smoke, do you deal with a lot of patients because of something like that as well? Is that another part of your day-to-day people that maybe have never smoked before, but they were always around smokers or in a smoking home?
It is. More so, I tend to see those patients when we think about asthma, that,
Sure.
that smoking, secondhand smoke is a trigger for their asthma, and how we treat that and how we avoid those symptoms or those exposures for
Sure.
those patients.
We're talking to Dr. Allison Cihla this morning, Preston Memorial Hospital, critical care medicine and pulmonologist. We'll continue the conversation on the other side of the break. You're listening to Mon Health Talk on WAJR. Joining us in studio this morning from Preston Memorial Hospital is Dr. Allison Cihla, critical care medicine and pulmonologist.
And we've talked about treatments and ways that patients can come and get support. But I want to just switch gears for a second and talk a little bit about the Pulmonary Rehab Center. There's a new grant for this, right?
Sure.
Very
yeah,
exciting.
It is very exciting. So we were blessed to receive this grant at the end of last year from 3 separate foundations, from the Claude Worthington Benedum Foundation, from the Dorney Koppel Foundation, which was founded by Grace Ann Dorney and her husband Ted Koppel, and from the WVU School of Public Health's Carolyn Haas Trust at the WVU Foundation. So we were very happy to receive these funds to further our pulmonary rehab program.
So all of these funds will come together
Correct.
to help move the program forward. And what does that mean for the rehab center?
So we are actually going to be the newest Grace Ann Dorney Pulmonary Rehab Foundation, or Pulmonary Rehab Clinic, which is very exciting. We will carry her name and the funds that go along with that, but this will allow us to provide services for more patients. Right now, we're in a very small space with limited equipment, and these funds will be used to purchase new equipment. We'll be able to purchase some new patient monitoring equipment, which will help us to more seamlessly move through the program. We're also hoping for some space expansion and some additional training for our staff.
Wonderful.
Yes.
And, as we are talking about all of these things, and we've got folks that are listening and they're thinking, you know what, this could be really beneficial to my life. Talk to me a little bit now about patient referrals. Is this something where maybe you are having some issues breathing, perhaps asthma related or something, and you go to your primary care physician and talk to them first, or how does all of this work?
Our patients are sent to us based on physician referral. So if anything we've said today seems to hit home for you, any pulmonary symptoms or testing you think you may benefit from, the best place to start is with your primary care physician, and talk to them and tell them, this is what's going on and where do you think we should go next, any testing or referrals.
And when could someone, once they do speak to their physician, when do you do testing? Are there only, because I know certain places there's certain hours and it's kind of a hassle. How does that work for you guys?
Testing at Preston Memorial is offered on Mondays through Fridays from 8 a.m. to 4 p.m.
So pretty much anytime.
Pretty broad. Yes.
Yeah. All right. Well, that's wonderful.
Dr. Allison Cihla, our guest in studio this morning. I'm going to ask you a question. I've not asked anybody that's come in studio yet, and I don't know why I haven't asked this yet. What's your favorite part of your job?
Oh.
I I love interacting with the patients. I'm not from West Virginia originally, but my family is. My grandparents were born and raised here, and so it's nice to hear stories and meet people and learn about their lives.
You know, my wife's grandmother's been in the hospital recently, but so much of the conversation is just based on, oh, that doctor, I liked him or her, or that nurse, oh, I really like her. The impact you have, you probably see hundreds of patients a week, thousands of patients a year, but the impact you have on each one person, I mean, that's a major impact. And they remember, I don't know if you remember all those interactions, but I think the
Right.
patients certainly do. So,
I hope so. That's why I went into this profession. So
are you nice?
I think so.
Well, we haven't gotten to know you for very long, but you seem very nice.
Thank you.
I would not be afraid to come and speak to you and get some testing.
Thank
so
you.
if there's my endorsement for anybody out there listening.
Dr. Allison Cihla, Preston Memorial Hospital. Can we go online, find more information over at the Preston Memorial website? Is that the place to look?
Yes, PrestonMemorial.org is a great place to look and see what services we offer and testing that we offer.
Yeah, and don't forget, if you are in Preston County, Kingwood, and you don't have to just be in Preston County, but again, so many times you just have this conception in your head that, oh, I got to go to Morgantown for that. Oh, you should really go to Pittsburgh for that.
You don't have that excuse anymore.
No,
You should be getting your testing done because you can do it right there in your backyard.
Exactly.
see, you were going the excuse route. I was just saying convenience-wise.
Sure.
It's right there, and you don't have to make those big trips.
That's right. It works for both.
See, Sarah's over there trying to make excuses.
I'm trying to guilt them into getting their testing done so we can keep everybody healthy here.
If you missed any of the program, it'll be posted at the Mon Health webpage, by the way. Video, in case you're curious to what we look like.
Ugh, I don't know why you would be. We do radio for a reason.
That's right. We chose this occupation for a reason. You can check it out there. And again, don't forget to visit the website. Go see Dr. Allison Cihla, Preston Memorial Hospital, critical care medicine and pulmonologist. What interests you about law? Why go into that specific field, by the way?
Oh, he's putting you
know.
on the spot.
Yeah.
I really just like that it's not just the lung, but the lung ties into so many different organ systems in the body that allows me to stay up to date on, neurology and cardiology and everything else as well.
All right. Do you have to get out to Kingwood? Or are we giving you the day? You know what? You take the rest of the day off. It's on us. Well, thank you for stopping by very much this morning. We appreciate it.
Thank you.
Again, you can watch this episode over at Mon Health's website. Don't forget you can visit Preston Memorial Hospital's website as well, get more information on pulmonary care there. And go see Dr. Cihla. She's fun. Trust me on that. All right, news coming up next, then the talk of the town right here on WAJR.